treatment of choice.
You can look again. Just try to see, look at the appearance. Intraocular tumor, yes, you are right. But anything more? Do you see the appearance? Do you think it is a little typical of some particular tumor? What are other intraocular tumors that you can think of except retinoblastoma? Yes. So what is specific of retinoblastoma? What will you see more? Do you see something?
Calcification.
Correct. So can you see calcification here? No, right? So this
The
is
choroidal
collar
melanoma.
start appearance of your choroidal melanoma. And anything else that you can see here? Apart from that, something in the second image, just above the mass, the straight. No? Okay, fine. So what would be the treatment of choice? How do we treat choroidal? Surgery? With surgery? No? Fine. So you've answered partially, we can give 5 marks. So treatment of the choice would basically depend upon the site of the melanoma.
Diagnosis, and what are the indications for surgical intervention? So you can see something over there? Can you see something? So you can see what is this, and what is this?
Define the diagnosis.
Choroidal detachments and they are in contact with each other.
Yes.
Choroid kissing, choroid.
Correct.
Correct. So then what would be the indication for surgical drainage of a choroidal detachment? So what type of choroidal detachment is it? Hemorrhagic, serous? Serous. So what would be the indication for choroidal detachment?
What is the surgery that is on in a choroidal detachment?
Drainage with what? How? Where?
And when would you drain it?
What are the conditions when you would drain?
Would you drain every case of choroidal detachment? No. So what are the indications?
Correct. Hemorrhagic choroidals, if not resolving on their own, would be one of the indication. But what?
What's the bonus question?
Neurocystic sarcosis with a
Neurocystic sarcosis. What is neuro?
Is it happening in the brain?
Brain. Can you see the brain?
ocular cystic sarcosis.
Ocular cystic sarcosis. Right. So where is it?
In the muscle.
Right.
Correct.
So it's in the muscle. And
Very good. Go ahead. The next
what
part.
is the treatment?
We give steroids and albendazole.
Correct. So what type of scan is it? Is it a normal ultrasound that you see? Is it ocular B scan or something else? The mode is different here. Yes, orbital mode of ultrasound. So that's how you get to analyze.
What are the long-term implications of it?
So first identify what is it.
So what is the abnormality that you can see?
T-shape.
What is this that you are seeing?
Is it normal? Is it abnormal?
What is this?
Something over the optic disc.
So there's no optic disc, but you do see some shadowing behind that hyperechoic thing that you see, right?
So we are saying that this is not the optic disc. Now what can it be then?
That has led to that sort of back shadowing.
We are telling you that this is not the optic disc area, but still that shadowing is present. So it could be
And in front of that shadowing, you see that hyper-echoic thing that you've pointed, that T thing that you've pointed out. You see it right there, right, on the retina. So what could it be? That leads to an after shadowing.
Find the question.
So,
Team
question
one.
passes on to team A.
Would you like to attempt?
The next team.
Team 2.
No.
Team 3.
Intraocular foreign body.
Correct.
Right.
Very good. So it is an intraocular foreign body. Okay. So that back shadowing itself gives you a clue that it is an intraocular foreign body. An intraocular foreign body will lead to hyperechoic spike. Can you see the spike? Corresponding A scan spike, right? It's a full 100% spike. So if I say that this foreign body is metallic in nature, what could be the long-term implications of it?
Siderosis.
So what will siderosis lead to? How will it present? It can lead to cataract, and eventually over a period of time that chronic inflammation will eventually cause phthisis bulbi of the eye. Okay, how do you monitor any intraocular foreign body if an intraocular foreign body has been left inside an iron foreign body? You know it as the patient is a case of siderosis bulbi, and you want to know whether this foreign body is actually, you know, affecting the eye. How do you measure it? Measure the effect of it, or you want to see whether it is causing any effect. So it basically goes and affects all the pigment layer of your eye, right? So you can do an ERG. Okay, the B wave gets affected and eventually it gets into negative. Otherwise B wave is positive, right? So it becomes negative.
Alright, so we are done with the first round.
We can
I think it's CSR.
where is the elevation?
Which layer
Which
is it?
layer is involved?
This red color line, what does this line depict?
Elevation between NSR and the RP layer.
Which
Is it
the-
between neurosensory retina and RP layer, or is it somewhere else?
Which is the RPE layer?
Red only RP.
Yes.
Correct. So that
So
that is also elevated. No?
Yes.
So there has to be something behind
Beneath
Occult
the
CNV.
occult CNVM. Okay, you're going on the right direction, but
something else.
something else that you need to see.
Something which is not very commonly seen,
Hmm.
but will present like this.